I told you guys that I was going to go live on tonight, so thank you for joining me. And I'll take a little bit, try to make sure I have all my notes together. I'm sure that everybody won't be able to join right now, so this is really good for you guys to be able to watch a little bit later in your spare time. Like it, share it. At the end, I'll be seeing if you guys want to give any feedback or you can inbox me or something. So, hey! Hey, Stanley! uh, Pretty good. So, thank you for joining me. And while I realize that everybody is not a healthcare professional that is a nurse or a CNA, I think this will be helpful to any role that you play in the healthcare field if you work closely with nurses or CNAs. I know that when we go to nursing school, and I'll tell you a little bit about myself in a minute. I love you guys too. When we go to nursing school, even though everybody does not get to practice as a CNA, a lot of the teaching is surrounding direct care. So they teach us how to make beds. They teach us how to provide incontinence care. They teach us how to give bed baths. They teach us the very basics that we need to be able to provide direct care given the time or given the place where we have to do it as nurses. So just a little bit about me. I have been a nurse, or I've been in the healthcare field for 18 years. So 18 years this year will be my long-lived profession, career in healthcare. I started as a CNA at the age of 16, and I did that for about 2 years or so, and then I went to Chicago Public Schools practical nursing program, awesome program, where I completed my LPN. So that's a licensed practical nurse. I did that while I was in high school. So I became a nurse at 18. My junior and senior year, I went to high school part-time, and then I went to nursing school the other half. Hey, y'all. I worked as an LPN for 5 years or so, and up until I graduated from St. Xavier. So any of my alum out there, how you guys doing? I went to St. Xavier and I obtained my bachelor's degree in nursing, and I have been an RN since about 2006. I've worked in the hospital setting. I've done private duty nursing. Of course, I've been a CNA. And I've done multiple things in leadership. As an LPN, I supervised or assisted with supervising the house. Long-term care is my absolute specialty. So out of hospital, private duty, hospice, supportive living, those types of scenarios. Long-term care is where my heart is because I love to work with the elderly. And if you have ever seen me post on Facebook, then you know that the elderly are my favorite. From there, as an RN, I provided direct care on the floor. I also supervised. I became a unit manager because one of my good friends called me and she thought that I would be really good for the position, which turned out to be, one of the callings that I have. So I worked as a unit manager. Then I became an assistant director of nursing, or an ADON. Then I became a director of nursing, or a DON, right? And now I am a licensed nursing home administrator. So I am a nurse by trade. I do run a nursing home right now, and I absolutely love my job. I love the people that I work with. I love every part and things that I encounter in this field. So, why are we here? We're here to discuss 10 things that a nurse can do to help lighten the load of the CNA, because they have a tough job. They are the heart of our day-to-day functions. They have the most physical part of the job when it comes to healthcare. And to be a good nurse and work with an awesome CNA, when I tell you that the two of those go together like macaroni and cheese or peanut butter and jelly, you want to make sure that you know some things as a nurse that you can do to help your CNA. I did speak to both nurses and I spoke to CNAs, so I wanted to try to make sure, we had an even balance on what people felt, because as a CNA, I'm sure we can come up with 1,000 things a nurse can do to help us. But we do understand that the nurses do have to take care of the patients and in another fashion or manner. But at the same time, nurses should be multifaceted and multitasking. So, number 1, answer the call light and fulfill the need. So, how did you know that would be my number 1? That came from both sides. So, answering the call light. It is everybody's job. This is not one way that a nurse can help a CNA. If you work in the healthcare field and you are in housekeeping, if you are in dietary, you can answer the call light. This helps everybody. Plus, it keeps that light from ringing for so long. So, when you're in a room and you've answered the call light, or if you visit the room because you're passing medications, ask the patient, is there anything else that you can do for them beyond the medication administration? But here's the catch. You have to do it. So, answer the call light and fulfill the need. Ask the patient, is there anything else that you can do beyond the medication administration? And you have to do it. 2, be proactive. There's nothing like being proactive in a situation. And under being proactive, I have sharing the responsibilities. So if you and the CNA work together, sharing the responsibilities, the both of you will have a better shift. So take a hands-on approach. That will increase the chances that, 1, you can discover an acute change in your resident. For example, in my workplace, the CNAs have assigned dining room times. So if nurses would take the liberty or be proactive and say, you know what, I'm going to do the dining room time for my CNA, or I see she's having a rough time, let me step in and do the dining room time. Your eyes are trained to see things beyond sometimes what our CNAs can see. So just doing a dining room time can help you catch a patient experiencing an adverse or something abnormal. So taking a hands-on approach will always help you to see if your patient is eating enough food, what patient is not eating enough food. Just doing a dining room time, something as simple as that, can help another patient. Number 3, nurses can help to feed patients, even if it's one. Take the patient who eats really fast. We all have a patient who eats really fast. So I know you know him. Scarfs it all down. Yes. Even if it's one, that is one less patient that your CNA has to feed. Number 4, help to pass the trays or help to pick up the meal trays. That's another task that requires minimal exhaustion, and it takes little time to help pick up the trays and for the dietary people to take them back down. So if you don't work in a setting where you have to do those things, then helping to make sure a patient eats, that's another way to take the load off your CNA. Number 5, make a bed or strip a bed. So if you know by going through school that making a bed or stripping a bed, those are also 2 more things that require minimal exhaustion and it requires little time. So if you're pressed for time, or you have a situation going on, or there are multiple things that you know you already have lined up that you have to do, then small things can also take a little bit of the workload off your CNA. Number 6, empty the linen carts. This is another thing that anyone and everyone can do. You always want to make sure that we don't get in the habit of saying, that's the CNA's job. Hey, Russia, I see you. You always want to make sure that everybody participates in a task that everybody can do. So saying that's the CNA's job, they're probably not going to take that too well. Next. So number 7, learn how to work any of the equipment that the CNAs are trained to use. Anything that they frequently use, you as the nurse, you should know how to use it as well. You never want to be in a situation where you don't have a CNA. You can't work the equipment. Learn how to use the equipment that the CNAs frequently use. For instance, if the CNAs use transfer or lift machines, you always want to know how to work that, because you can assist them in, one, lifting or transferring a patient if your CNA is busy with somebody else, or you can just be there. If something's going wrong, let's say you have a new CNA, you always want to be able to work any equipment that your CNA frequently uses. Number 8, give a shower. If you know you have a quote-unquote quiet set, or a group of patients, or you have more downtime than your other fellow nurses, why not? Take one for the team. I say give a shower. I've given a shower. Hey, it's going to mess your hair up. You're going to get wet. But guess what? Your CNAs value you. They know that given a situation, you're one of the ones that'll step in and help them out. And it gives them something to, be a little bit more motivated about, and they will take some of that extra weight off of you when you're having a rough day. So if you see your CNA struggling, or you know you have downtime, give a shower. I had a note on the side that says, as nurses, we forget we are just as responsible for the grooming and the well-being of the patient as the CNA. If your patient is dirty, it's your responsibility to make sure that they're clean. So make sure that you are being an active participant in your patient's care. Number 9, super top priority for me, and one that I think is one of the most valuable things that we can do, is providing incontinence care when you're faced with it. You cannot shun away from direct care. It's everywhere you go. If you're a nurse, direct care is what you do, not just pass medications. It can't be just that. So I know how it feels to become anxious about getting out of the facility on time or getting off the time clock, and there are a lot of demands that you have to meet as a licensed professional, but you always want to make sure that you participate in incontinence care where you're faced with it. So, for instance, if you answer the call light and the patient is visibly soiled, and let's say they say, I've been waiting for X, Y, and Z amount of time to be changed. Guess what? You should change them. You shouldn't let your patient sit there any longer, because we know all the things that can happen, or the things that come with not providing timely incontinence care. So I say, get yourself ready. I know that this is a hard one for some people, but as a nurse, you should provide incontinence care. And number 10, and then I have a little couple pointers for you guys. Number 10, be an example. Be an example. If you know that you go above and beyond, and if you know that you don't go above and beyond, a key thing here is to be an example. emotionally, professionally, and actively. Be an example for your team members. A nurse who puts forth an honest, hard, sincere effort consistently is sure to rub off on another nurse at some point during your career. So, what you want to do here is incite greatness. So, those are the 10 things that we can do to help our CNAs and lighten the load for them. I have a couple more notes that I took from one of the CNAs that I work with, and she is awesome. She's awesome. So what she says here is that when your CNA needs assistance, you can actually assist them. So you don't have to go and look for another CNA if you're there. Assist them and then move on to the next job that you have to do. The CNAs like to get a report from their nurses. So what you want to do is, if you know that the CNAs are coming on, they don't get a chance to give report, you want to give them a rundown of their patients. Did the patient have a fall? Are they having any diarrhea? People that you need to check on more frequently. They want a report. They want to know how to take care of their patients. Another one was turning patients. They want to have help turning the patients, doing it together. And what we found was that if you turn the patients with your CNA, just putting your hand on a person's skin, you can find out if they have a temperature. You can see if they have an open wound. So that's a really good thing. I like that, helping to turn the patients with the CNA. Another thing that she said was, don't have a "it's not my job" attitude. Now, this is not just limited to nurses. We have fellow nurses and fellow CNAs who feel like if it's for a patient or another patient, it's not their job. So you don't want to have a "it's not my job" attitude. Taking care of the patient, whether it's your patient or someone else's patient, they're all of our patients. So you can't have a "it's not my patient, it's not my job" attitude. She gave an example of something that was, it was quite disturbing to me, because I like a teamwork approach when my nurses and my CNAs are working together, or when I was a nurse on the floor and I had to work with my CNAs, or when I was a CNA. So I can go all the way down to, the basics. So I understand. She said that the nurse pressed the call light while the patient needed to be put on the bedside commode to get the CNA to put the patient on the bedside commode. I'm not going to go any further with that. You know that if the patient and you are in the room as a nurse and they need to be on a bedside commode, the commode is right there at the bedside and you can put the patient on it. That's wonderful. So, to my CNAs, rules of thumb, because I know that things can get rough. You never want to let the nurse or the person that you're working with determine your workflow. Your passion determines your workflow. As with any profession, some nurses will be awesome and some will not go above and beyond for you. You have to let your passion determine your workflow. Another rule of thumb, find a tag team partner. If you know that there's somebody that you work with and you guys can kill it together, I suggest you teamwork and make the dream work. So find a tag team partner. Even if the person works on a different floor, it's usually somebody you might have started with. You guys tag team and get the work done. Do not let the nurse determine your workflow. Your passion to be a healthcare provider and provide good care is what should determine your workflow. Another rule of thumb, always work safe. Do not perform a task unsafe. If the facility or the hospital or the nursing home you work in has guidelines set for you to follow, always work safe, smart and safe. You do not want to do anything to jeopardize a patient's life or causing them physical harm because you couldn't get the help that you needed. So always work safe. The last thing that I wanted to make sure that I addressed was I had question posed or a statement posed about addressing staffing issues, because a lot of times staffing can be challenging in some of the facilities that we work in. My suggestion as it relates to staffing issues and how things can become challenging for both nurses and CNAs is that we ultimately get to choose the places that we work at. You know what is safe for you, and you know what is unsafe for you. And there are multiple facets in healthcare that we can work in. You have settings where you can do one-to-one. There's no staffing challenges there. You have settings where you can do assisted living, supportive living. As a nurse, you can be in MDS, care plans. If people don't know what the MDS team does, you can also work in other areas where you don't have a high ratio as another place. So, for example, I worked in multiple areas in the hospital. On the cardiac unit, they gave us anywhere from 5 to 7 patients. On a ICU or in the ICU, you may have 1 to 2 patients. But there are different things that are involved when you take care of those patients. So there are multiple areas that we can work in, and you know how much you can handle. But I will say that staffing is a challenge, and the more you work together, the more you guys can accomplish as a team. I promise you that it will work out better that way. So that's the end of my live. And if you have any questions, or you know a topic that you want me to try to tear apart and put it out there for you guys, all you have to do is hit my inbox with questions or topics, and I'll do it again. So I hope you guys enjoyed. Have a great night. I'm going to watch the NBA Finals because I'm rooting for the Warriors on tonight. So good night and God bless.